next group has focused on SDGs 1 and 3 with their project Low Cost Medical Services Database, the connections between homelessness and health.
Hello, and welcome to the presentation about SDG Group 6. We are working on SDG number 3, Good Health and Well-Being, and our project is a website to bridge the information gap between low-cost medical service provider and those in need. The main catalyst for this project was the identification of a gap between public healthcare coverage in Canada and uninsured individuals, particularly immigrants, who cannot access that level of care without paying money that oftentimes they don't have, and also about for a lack of information on dental and mental health consultation. As such, we devised a literature review and a website structure that will be covered in the following slides that will provide easy access to information on non-governmental organizations that are providing services, how they are, how much they cost, what's their accessibility, and specifically what service do they provide, which is there was a lack of information identified on websites that did even provide lists of these kinds of services. It was simply a general overview that a place existed and not necessarily a detailed account of what services were provided. We also tried to approach the display and conveyance of the information in order to make it appropriate for uninsured individuals who oftentimes do face a social stigma about not having health insurance or not being of a certain social status or financial status or immigration status. And yes, so all that information will be covered in the following slides, and thank you for listening to our presentation.
Our key objective is to improve the well-being of the uninsured people. However, we are also not sure whether the uninsured people are not visiting the clinics because of what kind of reasons. So before we go ahead with the website's construction, we are also doing some kind of literature review in order to ensure that there is research in the past to support that the information gap is an issue leading to the uninsured going less to the clinics. We did find some research, and one particular one is being carried out in US in 2001 by Kenny and Haley. And based on their research results, there are residents in US who never heard of the programs of Medicaid or CHIP. And the reason is that they believe that their children are not eligible or lacking sufficient information about the program. We believe that this kind of research results is also applicable to Canada. And in our case, the people in Canada, the uninsured people in Canada is not going to the clinic is also because of an information gap. Once we have established that the information gap is one of the key reasons, we start the data gathering process to construct our website. Obviously, the most critical information is coming from the supplier of those low-cost medical services. We try to collect information about basic information on address and telephone number, opening hours, the service provided. But there is also additional information needed which can facilitate the uninsured people going to visit the clinic. Those include for example, what kind of language is available to be communicated between the service team and the client. In particular, some of the clients is coming from immigrants. They may not speak English fluently. And as well as like another factors, which is like whether the clinic is accepting new patients. So we try to gather those information. If those are not available in the website, we try to gather those information through email exchange of with the supplier.
Hello, I'm Ashraf Hutchcraft. I am one of the members of the SDG Group 6, and I will be walking through what the prototype of the website looks like. Here we have, keep in mind this is still a prototype and it's not the final product, but it's more of a proof of concept. Here we have the landing page, which has the website title, which is still to be determined. This is simply a placeholder, description, a search bar wherein the user can enter what kind of website, what kind of service they want, and in the final product, there would be a search page that would pop up when a particular criteria is searched for, and there would be a list of services that match that criteria. Unfortunately, that's difficult to put in unless there is a like a what is that, a framework already built to do that, which usually can only be put in via a subscription service like WordPress or Gravity View. This was made using raw HTML and a service called WebSlides. So the search button does not go anywhere, but it will in the final product. To go to the next page is a catalog of all the data that has been gathered by the other team members. Here is just scroll through to find the appropriate entity. It's all the information needed is here: clinic name, operating entity, contact address details. All of it is there and can be sorted through or scrolled through. It can't be sorted through because this is just a representation of the Excel sheet, but it is easy to find what you want because of the detailed information, which is one of the primary concerns of this database, is that there was no website that had such detailed information about what services were offered and what their cost was, which I'm sure my colleagues have said in their slides. If we scroll to the next page, there's credits for the creators and references for the links and the image used. It is quite bare bones in the prototype, but in the final product, it would be more interactive and better presented, especially the table. But as I said, that can only be done with frameworks and is difficult to do in raw HTML and CSS, especially given the time constraints. Thank you for listening.
We were able to discover a multiplicity of healthcare services that promote the overall health and well-being of care recipients at a low cost. Although we were able to locate medical centers that provide basic health services such as physical examinations, immunizations, dental, and physiotherapy, equally so, we were also able to discover services outside the scope of typical health provisions. For instance, since physical activity contributes to good health, we included low-cost extracurricular physical activities as an inclusion factor within our research. Embedded within these programs are also nutrition-based classes which simultaneously teach children good behavioral eating habits. That way, we are able to comprehensively expand the definition of healthcare to also include sustainable ways that promote the longevity of good health statuses for all. Although the purpose of this project is to inform future patients of already available low-cost medical services, it does not ascertain nor confirm the quality of care that is provided from the recommended services. The reason for this is mainly due to confidentiality purposes, since we cannot individually obtain a client list from each service provider to perform customer service satisfaction surveys. It is hard to determine whether such suggested services are even recommended by its users. Equally noteworthy is the fact that many low-cost services are provided on a voluntary basis. Therefore, it is rather likely that each patient visit will be serviced by a new medical physician. This is not an ideal circumstance, as it can potentially jeopardize the continuity of care for patients, which can potentially do more harm than good in the long run. Lastly, it is not uncommon for small healthcare organizations to change locations over time. The reason for this is that funding trends may change the trajectory at which care can be adequately delivered and where that care can be provided. Therefore, if a patient becomes well acquainted with a medical service in Scarborough, for instance, if that same center relocates to Brampton, the problem of physical accessibility can arise as an unfortunate byproduct of relocation. The purpose of websites are to provide web users with access to particular information and/or services that they are in search for. The problem with the search mechanism is that many websites exist under particular search items. Therefore, it is quite common for well-intended websites with useful information to have low engagement in terms of its user traffic. Considering this, we believe that accessibility towards our website can be enhanced via search engine optimization tactics, where we hire a person who specializes in coding that can make our website SEO friendly. That way, with the simple search of low-cost services in Toronto, we can then ensure that our website will be listed on the first page of a Google search. Another way to increase traffic to our website would be to distribute brochures at all immigration offices located in Toronto so that future patients can receive basic information from the informational templates and therefore be referred to the website for further information. In addition to this recommendation, since 1 in 4 people in Canada was a landed immigrant as of 2021, it is a logical assumption that language barriers can also pose as an accessibility issue. Therefore, the usability of our website can be further optimized by embedding a translation engine on our main page.